And let's see, questions about the emotional aspect of weight loss, the medication, or maybe you just want to share your results, encourage others who are here. Of course, we're talking about the emotional benefits of weight loss. Just listening to someone else, right? This is what happened. This is my result I'm getting. This is how I manage this, and so on. That definitely helps, right? If you have general questions, also, we're definitely welcome. And as always, we'll stop at 7 p.m. Central Time. That's in about 40 minutes or so, such that those of you mindful of our time. We are all super, super busy in the US, right? But we'll stay back if there are any other pending questions. So let's start testing. I see your hands up. You can raise your hand or put your question in the chat, and we will take it from there.
Okay, good evening again.
Good evening.
Good evening, everyone. Yeah, I have a question with respect to the medication.
Yeah.
You said people on high doses that they have two options, either to go for the one without the vitamin B or to go for the one with vitamin B. If we want the one with vitamin B, we need the two syringes. We have to use two syringes. But if it is the other one, it will be one. But that one will not have a vitamin B in it.
Yeah.
So my question is this: does it mean the vitamin B is of minimal importance to us for us in this journey?
Good question. And short answer, that's correct. Vitamin B12 in it has no effects whatsoever on your weight loss. So whether there's vitamin B in it or there is none, it doesn't change your weight loss. Some people have told me, however, that the vitamin B12 seems to give them a little bit boost in their energy. But when my wife switched from Zepbound, the brand name for Zepbound, to the compounded, she herself told me she noticed that the nausea reduced. Like I didn't know that. So those are some little differences, but when it comes to the actual weight loss, no difference. That's why for us, it doesn't really matter. One little advantage is that the pink color seems to just help when you're pulling the medication out. And it has such a satisfying effect seeing it pink come out of the syringe. But the majority of people don't want to change. But know that, yeah, it doesn't really matter. If you love the pink, just stick with it.
Okay. Thank you.
Yeah, my pleasure. I see someone, Samsung says, as a pastor, it became a real challenge. The shame is real. Yes. Thank you for sharing that. It takes a lot. It definitely is. And hope we can just help provide the guidance. It's definitely a tough situation to deal with. This one is a little tough topic there. And any other questions or concerns?
Yes. Hi, doctor.
Hello. Who is speaking, please?
Beatrice.
Beatrice. Yes.
Yes. Yeah, I wanted to comment on what she asked, the question she asked,
Yeah.
because at first they said the vitamin B12 is really helpful for the weight loss. And I don't know why it's not helpful no more. I don't know.
Oh,
I'm really concerned because that was the first orientation I got was it has vitamin B12 and which is really helpful, which was really good for weight loss. And new brands just keep coming in. And now
yeah.
I don't know.
Now this
I
is
really
this is the
don't know.
thing, right? Some wellness clinics they actually give vitamin B12 as weight loss shots, and I think that's where the idea is coming from. But if you go to in fact, even here around here, I know of some clinics. You go there for vitamin B12, they actually give it for weight loss. And some people have tested it as a little tiny fat burner. The truth is, vitamin B12 doesn't help your weight in itself. Right? Now, when we started, there's another, one of the reasons we were testing this other pharmacy, the carnitine, this other ingredient there, carnitine, they are all, let me put it, vitamins, let me put it that way. So there is a vitamin called carnitine. It's actually a tiny little fat burner. So technically, in some larger amounts, it can burn fat a tiny little bit. Right. So that is the one that was in this new medication pharmacy we were using. So that can help weight a tiny little bit. Right. So we didn't really see a lot of the result, and didn't want to venture into testing something that the quality is not, it's not really there. But B12 in itself, that's why if you come here, I can't just, if B12 was causing significant weight loss, I will prescribe B12 for you. The amount of B12 in the medication is even so small, so small that the benefits are not even there. So if B12 was very, very useful as a weight loss, and I'm very sure, this is what I'll do. I'll prescribe B12 for you as a standard medication with standard doses. So the amount of B12 in the medication is really tiny. For example, those who have B12 deficiency, if I have to treat them, there is an amount of B12 I'll prescribe for them. It's a very good, hefty dose. What you are getting is a tiny, tiny little bit. Right? So the B12 in that medication is so small that even if B12 has some positive effect on weight, it's really, really tiny. Now, the benefits that it can give is side effects. Like I mentioned, some people say, you know what, I feel a little bit of energy. Some people say, okay, maybe my side effects go down a little bit. But when it comes to pure weight loss, to tell you that, oh, no, the one with B12 will cause more weight loss than the one without, no, that's not true. Okay, completely not true. You can just get that settled. Maybe, I don't know, maybe, I don't know, maybe where the misunderstanding came from, right? It's just part of it is people have, it's just a general idea out there that B12. In fact, if you go to some clinics, they'll give you B12 shots for weight loss, right? So no, I hope that is very clear for everybody. The B12,
Yes,
the
sir.
B12, yeah, with or without B12, no effect whatsoever on your weight. It can have effect on the side effects. If you feel better with it, don't change. There's no reason to change from one to the other.
Thank you.
Yeah, pleasure. No, thank you for asking that question. It's an important one. I'm sure
You're
many others have
welcome.
the same the same question they haven't just asked.
Yeah.
Hi, Julian. I see your hand.
Hi, Doc.
Hello.
How was your vacation?
It went on very well. We drove long, 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 long distance, but it was fun.
Okay. Well, I started at 272 and I am down to 240.
You are down to 240.
Yes.
Congratulations.
All the summer clothes I bought last year, they are
Yeah.
now fitting me. They are
Yeah.
now, yes.
You have a different problem.
And everywhere I go, everybody is like, oh my God, what's going on with you?
Okay. And how does it make you feel?
Well, I feel warm and tingly.
Oh, that is so good.
So tell your wife that when I get to 200, that's when I'm buying my ticket to come to the office.
Oh,
And she
okay.
should and she shouldn't feel bad because I'm gonna hug you so tight.
Oh. Oh, that is so good. Oh, thank you. That's so warm, so wonderful.
But I walk a lot and the medication makes me eat like a bird.
Oh, okay.
Yeah. Like after 2 to 3 spoons of food, my
Yeah,
stomach is full.
that's correct.
Yeah. So is that normal?
Yeah, that's part of the way the medication works. And what,
Okay.
yeah, and what we want to avoid is, which you I guess you're already doing, is if you feel, because one way, what happens that, the best way to put it is, just imagine your stomach used to be like that, and then it shrinks down. That's the best way to
Okay.
explain it. So you eat
Right.
just few spoons and you're already full. Right. So
Right.
what we want to try as much as possible to avoid is not to eat at all. Remember,
Yeah.
I shared somebody here. She just didn't have appetite. I said went for 1 day, 2 days without eating. Like, oh, no, 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 we don't want that, not at all. Right. So instead of not eating, we'll want you just take the small amount of food that will fill that stomach. You don't need to eat 3 times a day. You can
Right.
eat 4, 6 times a day, smaller portions. That is way better than going without food. And
Yeah.
the challenge is it's a whole different way of living, which I really understand it. Right? You used to eat
Yeah.
because you're hungry. Now I'm telling you, you have to eat because you have to eat. You're like, okay, that doesn't make sense. You have to
I was e-
remember to
I
eat.
was I was eating before just because, but now with the medication, I have a purpose, and I
Okay.
realized that uh, I don't need the food like that, and I don't need the junk. And what
Okay.
makes me know that I'm doing well, I went to the mall over the weekend with a couple of friends, and I could have passed everything without stopping. No hugging does, no cookies, no
Mm,
no fast food, nothing like that.
yeah.
And my friends that were trying to tempt me to see, but I showed them they cannot tempt me.
I love that. This is
They
good.
said they said Dr. Oben will never know. I said, but I'm going to
Oh, that's so funny.
I said,
Uh,
but I am going to know. So I can't do that.
yeah, that's
They
good.
ordered everything and they put it in front of me and they're like, "Wow, this is so delicious." I did not let that phase me.
Wow,
Yeah. So I'm
that's
well
good.
disciplined because I cannot wait to book this flight to come to see you.
Yeah, absolutely. This is the office.
Yes.
Just come.
So
You have some red light therapy. You will give you some red light therapy and muscle treatments and everything we have here in the office. Oh,
I'm
beautiful.
feeling I'm feeling amazed
I can tell.
at the difference of me not taking anything to now me taking something.
Okay.
Yes. And I have to say this. You know, that week before I chose you, so many other places was, messaging me, and for some reason the spirit said just don't answer.
Hmm.
But when I saw your stuff, I heard that little voice saying,
Hmm.
he's the one.
Wow. Okay.
Yes, right. So I'm telling you, every dollar that is spent, it is more than worth my while.
Wow.
Yes.
Julian, thank you for sharing that. That's so good to know.
So that I got to get under 200 because America says 200, 201, you're obese.
Oh, dear Lord. That's so funny.
Another thing, I went to my doctor and they want to take me off the high blood pressure medication.
Oh,
I
oh,
guess because
yep.
yeah, I'm losing the weight,
Yep.
and
That's good.
every time I go, my pressure it has beautiful numbers.
Oh, good. That
Yeah.
that in itself is a huge benefit. Just coming off
Yes.
those medications, right? You feel it's worth everything if you can
Yes.
reduce medications by just losing weight.
I never thought I would have heard a doctor telling me, "Oh, I'm gonna take you off the." I was jumping inside that office. I was like, really?
Good.
And yeah. So I told them, I said, well, it's all because of Dr. Oben.
Okay, that's
Yeah.
good.
Thank
Uh,
you, Doc.
yes, Julia. No, thank you. Thank you for sharing that. Quite encouraging to me, the team, my team that's here, and to the rest of us who are here. Right, that's what we are here for. So thank you.
And
Thank you
and
for sharing.
and it's amazing because no side effect, nothing.
Yeah.
Absolutely nothing. No nausea, no headache. I sleep like a baby. I could break the house down and build it back in a less than a daytime.
Oh my. Oh, this is good.
So I guess this medication was made for me.
That's right. That's right.
Yeah.
We love those results.
Yes.
Yeah. You know, in the US, it's just I'm sure all of us living here, you know how complex the social economic issues around food and lifestyle and medications and the pharmaceutical industry is. Right. The majority of the chronic problems we have here in the US, they are related to lifestyle, especially eating. It's just a sad reality. And the pharmaceutical industry is meant to push medications to make money. It's a sad reality. You just have, it is what it is, right? You can, it's just the way things are. Right? Wait, if you look at the amount of money that is pumped into diabetes medications and resources for treating diabetes, you'll be amazed how much Medicare spends on that, how much Medicare spends on weight related obesity complications. Now, if they take that and invest in just getting people to be normal weight, this country will be far better, far better. But the complexities of doing that, the ethical issues, they are just too much. Right? So it is America. It is what it is. It's our responsibility individually. We figure out the right path, we work in it, and we get off. Yeah. I had a husband and a wife here in the office. In fact, the guy lost so much weight he had to stop treatment, I think a month ago or so. The first thing that happened to him, his blood pressure, he used to be on two blood pressure medications. He told me he gets up, he's feeling dizzy. This medication is causing him dizziness, and he was very concerned. So I told him, okay, you come. We asked him to measure his blood pressure. He went to his primary care doctor's office and measured it. I said, what was it? He showed me. I said, oh my God. You see, that's your problem right there. His blood pressure was like 110 over 7 days. I said, as of course, like, I cannot stop his medication. I told him, it's not safe to take that medication now. Stop it, hold it, call your doctor's office the next day. So he did. The doctor said, okay, hold the medications. And then he held it. Blood pressure was still low. They took him off the first one, still low. Took him off the second one, still low. Now, no more blood pressure, no more two pills to be drinking every single day of his life. Right? They had weight problems. Right? So lots of advantages. Tell me about those who, sleep apnea. Sleep apnea, sleeping, they can't sleep. One of the worst treatments we have here that patients hate and they have no option but to use it is this thing called CPAP or BiPAP. I don't know if some of you have seen this, the easier way to say the sleep machine. They put that mask on their face and they are sleeping. It's one of the most uncomfortable treatments. Terrible. We know. Terrible. But the problem is that of all treatments that are available, that is the only thing that works for sleep apnea. And that little treatment like that can control a lot of heart problems. Patients hate it. It's very uncomfortable. Can you imagine sleeping with your partner with that thing on the face? It's blowing. The guy cannot even sleep. And just losing 30 to 50 pounds, they come off of that thing. Amazing. That is like complete life transformation. Just losing 50 pounds of that weight, they stop using that nonsense on their face. I mean, how much money do you pay for that? Even surgery that will go become some complicated thing called ovuloplasty. They go in there, try to remove fat from the neck. It's not even guaranteed. Just imagine somebody like that is put on medication. It's going to cost them money for 6 months, and then they are down 50 pounds, and then that nonsense is not on their face. I mean, how do you compare both of them? Right. So really, really glad. I really thank God for these medications. Right, they are not perfect. They are not perfect at all. Some people have side effects. Some people don't tolerate it very well. Some people come off of it. They still struggle with the weight. We are still learning a lot. They have been now. They are getting to the market, getting to about 8 to 10 years. Right, we're still learning a lot about them. They are not perfect, but they are a godsend. Right? We wish that in next 10 years, it's going to evolve. It's going to be way better. And I'm sure I mentioned this to some of you that by the end of this year, or probably next year, there is a third GLP-3 coming out. It's going to be approved by the FDA. It's called retatrutide. In fact, we already have it. Right? For most of you, you don't need it. For a few of you, very few that are on 15 milligrams, 1 2 months, you're not losing weight, right? We've done everything. That will be something I'll prescribe for you, right? It is the next generation. It's now compounded. It's not FDA approved, but it's like a peptide that we can prescribe. It's going to be coming out. So the next 1 year will have something even better than tirzepatide. And then just imagine 2 3 years is going to be better. And it's just reducing the weight of people. It's a godsend. It's a blessing. For me, it is a blessing. It's I have seen how it has really impacted the lives of people. Of course, it costs money, and some of them have to be on it for a long while, but the benefits are way, way, way better. Right? Weight has trouble, so many problems. You all of you know, right? We don't really want to talk about that. So thank you very much for sharing all of that, Julian. Really definitely helps. I'm now enjoying having sex with my wife. My belly has shrinked. Oh my God, this is so good. I'm really happy with myself. I'm seeing my self confidence about my image reshaping. Oh, yes. Thank you so much for sharing that. That's exactly what we're talking about. We definitely want to see that. That confidence coming back and regaining yourself. Like, oh my God, America almost destroyed me. Told is telling me something I was not. Right now, regaining yourself, regaining your marriage, your sex life, regaining everything, confidence. There is no amount of money that can be attached to that. Right, it's worth every little bit of tiny shot once a week. Right, to keep that. Right, so thank you so much for sharing. Absolutely fantastic there. Let's see. No, any other questions? Let's see.
Hi, Dr. Oben. It's happiness. How are you? Welcome back from your
Happiness.
vacation.
Yeah, thank
Mhm.
you. Happiness. I'm doing well. Trust you too.
Yes, I am doing well. I just have a question.
Yeah.
Last Sunday, because I always get my shot on Sundays.
Okay.
So I finished taking it. Then the next day, I'm started to burp, in like a burping,
Okay.
indigestion. So
Yeah.
I just took omeprazole today. I bought it over the counter. So I
Okay.
just wanted to know, have you seen people that have indigestion with this medication?
Yes. It can cause that burping. Like that you burp and then you feel like stale food there. Right. And yeah,
Yes.
that's correct. And this is just starting for you. You didn't have that before. Is that what is that?
Yes, it just
Yeah. So
no.
it might be related to maybe food that you ate or something. Yeah, omeprazole, can it really help? Usually, if it's related to heartburns, like acid, it might help a little bit. Right. Now, the reason for that still that burping is it slows down your stomach. Your stomach, let's say your stomach used to contract like that when food is inside to push it out. Your stomach will be doing that. It doesn't make the food go out very quickly. And there is a different kind of medication that might make the stomach to contract a little bit more. Right? Most of you will not need it. Right? So what I would say is just see how the omeprazole does. Who knows? It might be related to the acid in your tummy. If you feel better with it, I'll say take it for about 10 days straight, 10 days or 2 weeks, and then stop. Don't take it continuously. All right. And if of course it continues and it's getting worse, next thing I'll say is try to see if it's related to something you're eating, whether it's related to a particular food type or food frequency, food amount, or something else. If all of that natural ways fail, then we might have to look at medication. That might make your stomach just contract a little bit more. But since it's just starting 1 week, yeah, I wouldn't make too much yet from that.
Okay, Doc, thank you. So
Yeah.
I will need a prescription for another, because this week will be my last shot, so I will need a refill if you get a moment. Yeah,
sure.
and also I'm on 12.5 now, and in 4 months I have just lost 14.6 pounds.
Oh, yeah.
Yeah.
We should go up. You should be on 15.
Yeah, so
Yeah.
I need, to go up so that I can, you know. But I feel good, apart
Yeah.
from this one started, Sunday,
Okay.
but I feel good, and my clothes are loose. Everybody's like, "Wow, you're losing weight."
Oh,
So
okay.
yeah.
That's good. Yep. So Queen is here listening. Yes, she'll take care of it. You will go up to 15, right? And for everyone else,
Thank
I think
you.
this is the second time this week I'm hearing, right? Except for some of you, there is going to be a limit, especially if you have side effects. I'll be hesitant to go up very quickly with weight. But for everyone else, just know that the usual pattern once you get to the high dose, we don't want you to stay at 7.5 or just 10. The goal is to take you straight to 15, right? Except there is a side effect that is stopping it. So we'll go to 7.5, we'll go to 10. So know that every week your dose should be going up, except there is a reason, right? That I'll maybe tell you, oh, no, let's pause a little bit. If you've had side effects, we'll be slow to increase it. But if not, just know that usually every month, especially when you hit the high dose, you should be 7.5, 10, 12.5, 15, and you stay at that 15. Right? That's where we should be for everybody. If for some reason you're not going up on the dose, please let us know immediately so we can correct that. Okay, let's see. Seems seems we've exhausted the question. I know this was quite an interesting topic, right? Different from the usual one we we usually have, right? Talking about the emotions and weight and everything else. But yeah, if there's no more questions, that's great, fantastic. We'll have this video ready, and we'll probably have it as a guide also. We'll transcribe it, put it in your portal. I had mentioned before that we are working on your portal. We're actually working on that portal. It's going to be changed from just a Google document to an actual login that's going to have all of your information in there. Really safe, very comfortable for you. Right? You'll be able to log in, go in there. You have everything well organized for you. You see your medications, your orders, and everything very, very easily. Right? It might take us a couple of days, but once that is out, that will be a next big update for all of us. But besides that, you all have a fantastic week. We'll be expecting an email from us once this video is live. All right. Bye bye, everyone. Yeah, my pleasure. Thank you. Thank you. Yeah.